The National Paediatric Diabetes Audit, NPDA, collects information about the care that children and young people with diabetes receive from paediatric clinics in England and Wales. The purpose is to help services see where they can improve. The NPDA is managed by the Royal College of Paediatrics and Child Health and funded by NHS England and NHS Wales through the Healthcare Quality Improvement Partnership. In 2018 and 19, there were just over 30,000 children and young people with diabetes in England and Wales, about 2 in every 1,000 children. 95% of these children have type 1 diabetes, with the rest having type 2 or other rarer forms of diabetes. Every year, children and young people with diabetes should receive a series of health checks to help monitor their condition and identify complications. Some of these are for all children and young people, and some for those 12 years and above. It is recommended that all children should be offered 4 clinic visits per year, at which their HbA1c, height and weight should be checked. If you are 12 years old or over, you should also have blood pressure, urinary albumin, a check for healthy kidneys, eyes and feet checked. There are also some differences between type 1 diabetes and type 2 diabetes checks. For children with type 1 diabetes, you should have an annual thyroid check, but for type 2 diabetes, you should have an annual cholesterol check and a blood pressure check at every appointment. Over the years that the NPDA has been collecting information on the completion rate of these checks, there's been a steady improvement. Here are the key health checks completed for all children and young people between 2004 and 2019. However, despite improvements, we can always do better. Just over a half of type 1 and under a third of type 2 12-year-olds and up received their 7 annual checks. Please discuss these with your clinic to ensure your child is receiving the correct checks recommended for their age and type of diabetes. The really good news is that across England and Wales, the average HbA1c has been getting lower and lower. This will significantly reduce the risk of diabetes-related health problems in the future. This is as a result of a concerted effort by everyone involved in the care of children with diabetes, working together as multidisciplinary teams and part of a national network to improve things that matter in your child's care. Experts recommend trying your best to get an HbA1c of 48 millimoles per mole or less, as this reduces the long-term risk of other health problems related to diabetes. We still have some way to go for every child with diabetes to reach this target, but with everyone's help, the aim is to achieve this in the long term. It is important that your clinic and diabetes team are providing support to your child or young person, with health checks, advice and education for diabetes management, along with psychological support to help them achieve the best possible outcomes whilst maintaining an excellent quality of life. If you want to see how your clinic performs against others in England and Wales, you can, by looking at your clinic report on the RCPCH NPDA website. For more results and information, and to compare your clinic, visit the following links. Together, we really can improve care.